I've seen some stats over time, and they've kind of been changing pretty quickly as we understand more of the billing implications of using telehealth. But what are you hearing now around the ROI and whether it does or doesn't make sense as a kind of a measurement of time spent?
Well, I think an ROI of a video visit is no different than an in-person, as long as you have payment parity, right? So if we really think about telehealth as the vision to like leverage and treat more people, well, if we're doing straight up video, we're not doing that because we're just
No.
exchanging a one-to-one. So as long as you're still getting your professional fee the same, which I believe we should be, I don't see it would be years before it should be any different because it takes money to install all this, it takes money to run it, and you're still running a practice. So you still have a physical space that you're managing. But where I think we could really understand the ROI, and no one's doing it yet, I think we'll start to see things, is really looking at the overall idea of how much time do you spend on the phone? How much time do you spend on emails? What actually of that could be reimbursed because people weren't trying to charge those things before? If we really started breaking it down and looking at it, I think we could find the right ROI that would also leverage the right kind of clinician, because there's probably plenty of emails nurses can answer, plenty of emails, phone calls nurses can do. Then you can have an advanced practice level, then you can have a physician level. Those things will take time, and it also will take the ability for and it doesn't matter if you're a health system or a private practice, but we have to have the ability to see the data. So we have to understand, like, do you have encounter types that track phone, email? Like, can we actually see that data to extract it, to understand the minutes and the time you spend on these things? Some organizations like big health systems, if they have like an Epic, that's all that we can potentially find that data. So I think if practices don't already account for telephone and emails in some system, they should have encounters for them so that we could actually go back and examine that data and realize, hey man, you're spending X number of hours on this. One half of this could be reimbursed. The other half, okay, we just understand that's the cost of doing business. Like, if we could see all that, we can help them understand the ROI better. And this year, same, just sort of that idea of, since everyone's in more, we're still sort of in fire mode. We're not really seeing it yet, but that's where I would recommend to any practice is have in your account, in your EMR, even though it's a pain, have telephone and have email so you can actually extract the data and understand how much time you spend on those things.